My name is Ramon Sarmiento, and this is my classmate Aubrey Hill. What we're going to do today is go over our neonatal assessment.
Okay.
And again, we're just going to kind of start from when the baby's actually born. Once the mom delivers a baby, they're going to clean her up, they're going to give it to us, and then it's our turn. So the first thing you want to do, you want to check vital signs. This baby actually, this is actually a lavage. You have this
Yeah, I was
baby
going to
hooked up.
ask what that was.
Well, this tube is the gavage feeding is what it is. And they use this for babies in the NICU who are preemies.
Is that like an NG tube?
Yes, exactly. This is what they use for feeding. So they'll just put it down the baby's mouth, and they'll actually go ahead and inject food and medicines here.
Okay.
Usually preemies have a real problem when they come out feeding, so that's why they do this. This baby looks like it has a trach, and this is just a tube that goes into the lungs to help it breathe. And this tube would actually be used to suction to get all secretions out. That's how they would do that there. So we're going to pretend this isn't here. We're going to pretend we have a nice, healthy baby.
Okay.
And we're going to do this assessment real quick. So you want to listen to their heart. And of course, you're going to look for the same landmarks. You're going to start from the clavicle and go straight down. And usually, what I found is usually find the baby's heartbeat more in the center, like in the sternum. You want to listen for 1 minute because their heartbeats are really fast and they can be erratic. And then you actually listen to their lung sounds.
And I've heard like C-section babies, sometimes they have fluid in their lungs for the first 24 hours.
Yeah, and that's, and again, because they're C-section babies, usually when babies go through the birth canal vaginally, it helps with the lung expansion because it actually compresses the lungs, kind of forces all the fluid out. When the baby is actually out, the lungs expand, that's the air. So when you get a C-section baby, that compression doesn't happen. So you will hear fluid in the lungs. It does go away eventually. So that is something to look for.
Okay.
Glad you remembered that because I didn't. Okay, so you're going to start off. You want to go ahead and feel the baby's head. You're going to feel the fontanelle.
And that's a soft spot.
That's the soft spot, yeah. Because, of course, the baby's head is not fully formed, and that's just so we can go to the birth canal. So
and one's a diamond shape, right?
The diamond shape, yeah. The diamond shape is going to be in the back, and then I think the triangle's in the front.
I think is the diamond in the front and the triangle in the back?
What I think is you have the two sides here, and then you have the frontal. So you're going to be a diamond shape here.
Oh, okay, yeah.
And back here is going to be the other shape. But we should look into that just to make sure that we know what we're talking about. Okay, you want to take a look at their eyes. And what you're looking for is color. You want to make sure that the sclera is white. If it's yellow, that could be an indicator of jaundice. Okay. You want to check their nares. Babies are nasal breathers, so they're usually going to use their mouth for eating, not breathing. So you want to just close one nares. Make sure you have some the breaths are going through.
Okay.
Same thing with this side. Usually, if you just put your finger in the baby's mouth, you're going to check for sucking reflex. Okay. Make sure it sucks on your finger. And you also want to check the palate. Make sure the palate's fully formed.
So not like a cleft palate.
Exactly. That's what you're looking for here. Ears are a good indicator too because their ears, if you squish them, they should pop back. You just fold them. They should. That's just to make sure that you have cartilage formed. Unformed cartilage, you see some floppy ears sometimes. That could be a sign of neural defects, and so you want to look at that also. So going down, we're going to go head to toe. So you want to check their neck. You don't want to palpate any pulses on the neck, but you just want to kind of feel any lymph nodes, any swollen glands or something like that. Okay, you want to check their clavicles. Yeah. Sometimes through vaginal births, you'll get broken clavicles, and that sometimes happens. Okay, you want to check pulses, both brachial pulses. Make sure they're even. You want to take a look at their hands. Sometimes you'll see babies with hands or feet that are blue. It's called acrocyanosis, and it's just it's a circulation thing. Again, the body's just kind of shunting the blood to the vital organs.
So it's normal.
It's normal. You don't have to worry about it. It's when you see central cyanosis around. When you see like bluish colors around the lips, around the body, then it's a cause of concern. Okay. Okay. You're going to keep going down. At this point, you want to listen to their abdomen. Okay. You can do 4 quadrants, and your baby will be naked.
So it's just like an adult, 4 quadrant. Like here, here.
And again, you're just looking for the lung sounds to make sure that the baby's bowels are active. Continue down.
You listen longer than that, probably, though.
You usually listen, you have to listen for at least like 2 or 3 minutes to hear. Sometimes it takes a while. And again, you'll hear a little gurgling is what you're going to hear. You're going to check the femoral pulses here, and they're right at the groin area. And just, you can use your fingers this way. And again, you're just checking for patency. You want to make sure that they're even. At this point, you want to look at the baby's genitalia. If it's a male, you want to make sure that the testes have been descended. You can feel for them. You want to check the penis and make sure that what is the name of it? The opening, the urethral meatus is what it is. You want to make sure that it's center line. You want to make sure that it's not deviated at all. For a female, you're going to check the labia. Usually the labia are closed. And smaller babies, they might be a little open.
Like premature?
Yeah, like premature babies, exactly.
That's the same thing with if the testes aren't undescended.
Yeah, exactly. It's the same thing. So again, it's just it's a indicator of how mature the baby is. Let's go put our diapers back on. Okay. Now, if we check the peripheries, we start with the hands. Babies, if you put your finger in their palm like this, they'll automatically close it.
Oh, like that.
It'll look like this, yeah. And that's just a grasp reflex.
Okay.
All babies should have it. Okay. The rooting reflex is here, and you can see this baby kind of.
Oh, the rooting is in the mouth, right?
Yeah, and that's also another reflex where you actually just brush here, and the baby will turn, pretend like it's a nipple. It'll actually turn to whatever side that brushing is, and that's just kind of. And that's for breastfeeding. Now there we have the Babinski reflex. That's the Babinski reflex. And also they do the grasping reflex with their toes also. If you go ahead and put your finger here, their toes will curl around your finger, your thumb also. Okay. The Babinski, however, is you just grab your foot and you scrape it around here, their toes should flare out. Okay. And again, that's actually a sign of an immature nervous system. It's still maturing, and you see this. If this is actually a sign, if you have someone who has nerve damage, an older person, adult, if you do this, their toes shouldn't flare out.
It should not.
Yeah, but on a baby it should because it's still developing. Okay. So that's something you want to check. Okay. Now we're going to flip our baby around. And usually they're pretty small and you can hold the baby. Now what you're doing here, you want to look at their spine. You want to make sure that it's actually centered. There's usually a nice C-curve also on the baby when you hold it like this. Okay. You want at this point you want to really look at the skin also. Check for jaundice. Any kind of marks like Mongolian spots, stork bites, all this stuff is normal. Okay. You want to take a look at the anus, make sure it's patent. And that's about it. Do you have any questions about that?
Not really. I think it's pretty good.
Yeah, again, if you see, a lot of times in the hospital settings.
Oh, the Mara reflex, right?
The moral reflex.
The one where you kind of drop them a little bit and then they go, oh.
Yeah, that's right. We did do the moral reflex.
He's not going to do it. But.
No. Well, the moral reflex, we can kind of, and again, it's just another reflex that you're checking for, and just to make sure that their nervous system is actually working properly. And you would actually pick up the whole bassinet with the baby and kind of drop it gently. And usually the baby's hands will flare up like this, and then they'll kind of slowly go down. And that's what you call the moral reflex. Thanks for reminding me about that.
Yeah, sure.
Yeah.
Isn't there something about their cry?
Yeah, you do want to do that, and especially you want to. There's other things you can look for. A baby's cry, it should be loud. It should be lusty. Any kind of high-pitched cries, or is a sign of neural defects. Okay. Usually there's something wrong with the baby's neural system. Also, what else you want to look for? Breathing. When they come out, they should be breathing normally. Usually when babies are having trouble breathing, you'll see retractions. What that is there any soft parts around here, like around above your clavicle, underneath their armpits, or right below the xiphoid, you'll see the skin kind of go in. And what the body's doing is using these accessory muscles to kind of aid the baby in breathing.
And is it normal for a baby to have periods of apnea?
Yes, it is normal for babies to apnea is actually stop breathing. Yes, it is normal for a baby to have periods of apnea. However, if they last longer than 10 or 15 seconds, I think is what it is. Yeah. Yeah, then it's cause concern because babies their breathing is abnormal. So. Just like when you're checking the baby's breathing, you want to check it for 1 full minute just because of that. Because the breathing is regularly irregular, if that makes sense.
Is it right that a baby's normal breathing pattern is 30 to 60?
It is 30 to 60 breaths per minute. So it's a big variation, but you got to understand.
And the normal adult is 12 to 20.
It's 12 to 20, right. So you can see there's a big difference there. Also, their heart rate's a lot higher than a regular human's. Neonatal heart rate is 120 to 180. No, 120 to 160, that's right. 120 to 160.
And an adult is 60 to 100.
That's correct.
Okay.
Yeah, so it's a little tricky to count, but practice makes perfect. And usually you'll see, heart rates they're pretty high. But again, it's normal in a baby.
Okay.
All right.
Cool.
Okay.